Why is the management of waste suddenly an issue?
Well, during the Wuhan outbreak, we found a 600% increase in the amount of infectious waste, which overwhelmed the systems that were meant to deal with it.
Is there a difference between handling infectious waste and the kind of waste that they were handling in the first place?
Well, municipal waste is very, very different to medical waste. Medical waste contains a whole bunch of things. World Health Organization has 9 different things. I mean, things like radioactive materials and some other stuff that is very, very difficult to deal with. But you have things like used reagents, you have test kits, you have personal protective equipment, and you also have, obviously, biological materials. So those are really, really infectious. So you have to be very careful about how you deal with them. And during this outbreak, this virus is particularly adept at spreading. It's a problem.
So the systems in place to deal with ordinary medical waste from daily hospital activity were not adequate.
Well, we're in the middle of a pandemic. This is the real thing that I think some people don't quite get, is during these sort of pandemic circumstances, you have very odd operating systems, as we've seen in the economy and in shutdowns, but also in services. I mean, we're seeing COVID-19 waste in sewage water surviving for 14 days, so COVID-19 surviving for 14 days in sewage, and it's surviving between 2 to 3 days on materials that are in lab tests. So it's a very infectious material.
So what do the hospitals have to do?
Well, normally they have enough capacity in the developed world to sterilise it, but in the developing world, it's not so well done. There are some hospitals that will have sterilisers. There will some that will have on-site small incinerators. But the amount of waste we're talking about, it means that they need to have either very secure storage where people can't get at it to pick through it to try and recycle the waste, which is what happens in a lot of developing countries, or they need to figure out a strategy how to get rid of it. Now, not all of them have incinerators, large incinerators. So in China, they used, or PRC, they used cement kilns. So they put the medical infectious waste that could be combusted into cement kilns. And that 10% of the energy fuel for the cement kiln was made from infectious medical waste, and that helped them become the problem.
So incinerators and cement kilns, this sounds like not specialist, but certainly equipment that many hospitals won't have. Are they expected to suddenly invest in a whole new system of waste management?
Well, what we're worried about is that people overreact and buy too much equipment to try and resolve the problem when they realise there will be a problem. A lot of countries still don't get that they're going to get overwhelmed with waste. We're in the process of communicating that at the moment. The idea should be that you look at buying equipment that you can then use not only for medical waste but also for other waste in a way that you can invest in the future. So this is really a resilience measure. I know people are very concerned about the effects on the economy, social impacts, political impacts, but the issue with waste is not one that is front and centre for them.
So it's not a matter of simply finding a solution for hopefully the short-term incidence of the COVID virus. This is something they should think about planning for long-term management as a whole.
I think so. I think we're seeing that a lot of the developing member countries from the ADB do not have very robust medical waste treatment solutions. Places in the Pacific specifically, a lot of islands, they don't have any capacity. So what we're trying to do is figure out how we can deploy funds on these solutions to meet our customers' needs and the DMCs, but also to do it in a way that it carries forward after this virus. And if there is another outbreak or there is another public health emergency like an earthquake or flooding or tsunami, these equipment will be robust enough to be able to be used again.
But whose responsibility is it to build this new capacity? Is it governments? Is it the hospitals? Is it the waste disposal system as a whole?
I think it's probably the government's responsibility to identify what they want to do. We're seeing private hospitals, in our private sector operations, we're seeing some private hospital operators come and talk to us and say, can you help us with emergency funding so we can invest in this material? By the way, do you have people who have supply of the material who you know of? So over the last few weeks, we've been talking with a lot of the vendors and suppliers. There are a number of them, and material is available. I had a chat to one supplier 3 days ago who said something very surprising to me, that in January they thought they would have a surge in sales, and they are yet to see it.
You mentioned
So I don't think people are getting the problem yet.
you mentioned funding. On top of funding, there's also organisation and management and implementation. Who is going to provide all those services, and how? Because, as you say, a lot of these developing countries are not really in a position to be able to do this.
Okay, so there's a really good way of comparing that to the test kit problem in the United States, that they flooded the market with test kits, a lot of them didn't work. So in terms of responding to this problem, what are the appropriate technologies for the appropriate places? Putting in a microwave sterilisation system in a remote community is probably not a great idea. Putting in a microwave sterilisation system off the back of a private hospital, where then it goes off to a cement kiln where it can be automatically destroyed, that's a good idea. But I think there's a mix between doing the emergency incinerators, which are basically a box that comes off the back of a truck and you burn stuff in it with diesel. It's environmentally not fantastic, but the downside is if we don't do this, we risk reinfection or spreading of the virus through the rest of the community, specifically in slum areas, because they do a lot of the waste picking.
So obviously the challenge is to get up to speed and reinvent their entire systems very, very quickly, isn't it? What's the best way to do that? I mean, how can these people avail themselves of the knowledge and the advice as to how to proceed?
Well, we've set up a data room at ADB. I think you're going to put a link to that on the end of this video, hopefully, that talks about what equipment's available, what other organisations like the World Health Organization, the UN Environment, UNEP, and even things like the Basel Convention, which talks about shipping waste and handling waste. We have that data. We have a lot of data on vendors, and so there's available information if people want to look at it themselves. And also ADB is here to help them. We will be able to provide you with some advice, and if you need support, we'll provide whatever support we can.
Is it a case-by-case situation? I mean, you talked about solutions for situations, but are there a broad set of international best practice guidelines that people can refer to?
Yes, there are. So the World Health Organization and UNEP have some great information, and where you have a limited budget and you're in an area which is quite remote, surprisingly, there is information for that as well. Médecins Sans Frontières have a great little booklet on how to deal with medical waste if you're in a really remote situation where you don't have a lot of resources and money to fix it.